episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Everybody to another wonderful episode with a fascinating guest who is really involved in creating a better tomorrow for many people. So on today's episode, we are going to continue our virtual road trip over to the country of Rwanda, which in recent years, due to some very ambitious plans by their government, has undergone a major transformation into a regional high-tech hub, many people referring to as the Singapore of Africa. We are honored today to be joined by Professor Dr. Agnes Binagwaho, who is the Vice Chancellor at the University of Global Health Equity, which is an initiative of the Partners in Health nonprofit organization focused on changing the way healthcare is delivered around the world, training the next generation of global healthcare professionals in order to deliver more equitable quality health services for everybody. Professor Binagwaho is a pediatrician. She has served as in the health sector in various high-level government positions. First, she was the Executive Secretary of Rwanda's National AIDS Control Commission. Then she was Permanent Secretary of the Ministry of Health. And then for 5 years, she served as the Minister of Health. She is also a senior lecturer at Harvard Medical School. She serves as senior advisor to the Director General of the World Health Organization and is a member of the U.S. National Academy of Medicine and fellow of the African Academy of Sciences. She has over 150 peer-reviewed publications. Her research interests vary from everything including health equity and human rights to the implementation of science to improving care delivery systems. She specialized in emergency pediatrics, neonatology, and in the treatment of HIV/AIDS. She completed her MD at University Libre de Brussels and her master's in pediatrics at the University of Bretagne Occidentale. She was awarded an honorary doctorate of science from Dartmouth, earned a doctorate of philosophy from the University of Rwanda College of Medicine, where her PhD dissertation was entitled Children's Rights to Health in the Context of the HIV Epidemic. All that being said, Professor Binagwaho, thank you so much for taking the time out to come on the show today.
Thank you for having me, and I'm very pleased to speak to your auditors and to have a conversation with you.
Outstanding, outstanding, very much appreciated. Typically, I love to start off by handing our guests the microphone for a little bit to sort of go into your background, a little bit about, sort of everything from where you grew up, how you developed your original interest in science and medicine, pediatrics, and a little bit of your journey from Rwanda to Belgium and back to Rwanda to sort of the point where you came into the leadership of the Rwanda AIDS Control Commission. I think that'd be a great way to start things off.
Okay, so I don't like to speak about myself, especially because everything is already written somewhere. But I'm just going to say that I'm born during the colonial time. I'm a grandma, and I went in Belgium, from Rwanda to Belgium to follow my father. It was a family move. My father was going to study medicine in Belgium. But first of all, he went in Belgium to care about the Rwandan who were there in the exposition of the colonial part of the 1958 International Trade Fair. I think that's how we say that in English, for international. And you know that like all imperialists and colonial, they dehumanize you, and they show what they call the indigenous, the local people in cage, etc. And people come to see them and give them bananas and biscuits, etc. But because it was during the winter, they need somebody to care about them. And my father was medical assistant, so he volunteered to go there, and after that stay for study medicine, and we joined him there. So that's how I left. I was a very little girl at that time. And after that, I later on, to make the story short, I studied medicine, probably because my father was a doctor and I always wanted to be a healer. And came back to Rwanda after the 1994 genocide. But before that, I went to Gabon. My first contact was an amazing contact with Congo and Gabon, where I learned different philosophy, different way to see the world. And I believe that if I didn't have that period of my life, I would not have been performing in my own country when I came back in '96. And after that, when I came back in '96, there were not so many skilled people have been killed. And there were not so many people skilled. So because I study how to care about people living with HIV, and I am running the AIDS control program in Rwanda. And because probably I was successful, I was asked to run do the same for the entire health sector, and probably I was successful because I was requested to be the minister for a couple of years. And now I'm teaching to students everything that they have, sorry, I'm going to close my phone, everything that has been missing in my own training to handle and do what I had to learn by doing.
Outstanding, outstanding. I appreciate that. The theme of health equity is extremely it's extremely major topic today, but it's extremely important to you as well. And the National Academy of Medicine, which you're part of, has had many focus groups on the concept lately. We recently had Jim Weinstein on from Microsoft, who's sort of leading National Academy of Medicine sort of promotion of health equity in the United States. Obviously, you've been very instrumental in setting up the University of Global Health Equity, partnerships with the Gates Foundation, other organizations. Can you take us on a little bit of a journey on how the idea came about, what was involved in sort of setting up this new university, and a little bit of sort of your role as provost and head of setting its priorities? If you could walk us through some of that, I think that'd be a very nice introduction to what you're doing now.
Okay, so first of all, it's an African university based in Africa. It's an initiative of Partner in Health, and but it has been built by global health fighters who, the earth is not flat, it's round, and you need to put your global institute somewhere. And Rwanda was chosen because of what Rwanda have done in the health sector is exactly one of the best journey that we could illustrate. And also we got the facilitation from the government to receive a land where we wanted, meaning in the rural north, rural by purpose, because the majority of doctors and nurses are educated in cities, and after that, the place where they are missing the most are in rural, remote. And you ask young people to go and work in rural area after a couple of years living in a city, they feel that their life is finished, they're going to have a boring life, etc. But when you educate them in a place where they are the most needed, they will stay more with more pleasure, because they have been happy there and they see each and everyone being happy, doing his job in this type of setting. So that's the first thing. Second, if you look at the life of, and even I advise everybody to see the film, Bending the Arc, where young people, were Paul Farmer when he was young, and others ask themselves how to build a health sector, how to do this and this, and everything we learn and other people learn and have implement or achieve with success. We have done that in academic training, one of the most practical academic training you can complete, you can ever have. And that's how the idea of the university starts. Educate young people to do and to learn on top of the clinical skills of quality, what it takes to build the health sector where they can exercise the clinical skills, the quality clinical skills they have learned. Many young doctors and nurses are coming back in the developing world, and they don't manage to find that they fit because they miss the environment to exercise the skills. So we teach our students to build the environment they need to be performing with the skills we have educated them to have.
Outstanding. And in addition to your work as Vice Chancellor for this Short Breakthrough Initiative, obviously, and as mentioned at the beginning, you're involved in a variety of international initiatives. You teach at Harvard and Dartmouth. You're advising the WHO, part of the national academies. I came across a very interesting paper of yours from The Lancet from a couple of years ago. It was entitled "The Path to Longer and Healthier Lives for All Africans by 2030." And it was a very interesting topic because you touch on a lot of the issues, the challenges, say, in Rwanda previously in terms of infectious disease and malnutrition, but now you're dealing also with the prevalence of sort of first world chronic conditions now. It was interesting, through the National Academy, the vice mayor of Kigali, I had an opportunity to see a lecture. She was talking about sort of the turning of Kigali into this city of healthy longevity and wellness. Talk a little bit about what you're seeing sort of as we see this transition of Rwanda into this sort of this Singapore of Africa, some of the chronic diseases that you're going to be getting to deal with, and some of how you look at the concept of healthy longevity and wellness in the country.
So first, we are not in Singapore, we are in the heart of Africa,
Sure.
and we're unique, and we cannot be the reflect of a country
Sure.
where I even never went. I like what the leaders have done, and it's quite, there is a lot of similarities with what our leaders have done in this country. So we are also very different. We don't have access to the sea.
Okay.
And this is a riches that we are a landlocked country, so we have far more difficulties to claim the hill of wellness than you have when you have
Sure.
access to the sea. Or the good coming here have to come by plane or to travel across 2 countries in general. So this is the first thing. Second, what I can say is that the longevity comes by the control of infectious disease through treatment, through education of health professionals, and also what is going with, and vaccination, etc., for prevention and treatment, and improving of hygiene make people living longer. So, because they are not dying young with HIV, TB, malaria, gastroenteritis, and pneumopathia, they express diseases that are not diseases of rich countries. They are human diseases. And most of the time, we just, we did a Lancet Commission on non-communicable diseases and injury of the poor. And you can see that it exists even more. And if you see, even in the US, diseases linked to obesity, malnutrition not necessarily due to scarcity, but due to quality, is very high with obesity and all the consequences that it has. Even in a period like COVID, people are dying more because badly fed. So those diseases are not diseases of because you became better, you have a better life. It's just a disease you express because you live longer, because the system have managed to control infectious disease. And that's what we see all over the world, with better access to HIV treatment, to vaccination, and to hygiene norms. So we have that, and we need to continue to have the maximum of effort to keep those achievements, because they are very fragile. And now to tackle what are the major killers that are no longer infectious disease, are non-communicable disease, cancer, heart disease, stroke, and all a new array of disease that are now predominant. And it's a shift. And the most important to understand is that we should never stop what we do to fight infectious disease. Absolutely. And we can see that in a period where, like COVID, when people have no access to vaccination and primary care, people start again to die more if it's not cared of. I don't know if I answer your question.
Yeah, no, absolutely. You hit it right. And actually, it leads into my next question. And, obviously, you've had such an important impact via the AIDS Control Commission, with the work you've done with HIV over the years. You had, as Minister of Health, you had this amazing campaign to vaccinate children against papillomavirus, and I think you reached like 90-some-odd% coverage rate. Any interesting learnings that from the Rwanda side of things in terms of COVID, whether things that we could be applying more as you come over and lecture in the U.S., what we're doing wrong, what we're doing right here, please, important learnings from your side on COVID.
Very rapidly, what you are doing wrong, you don't apply science. And science is something beautiful, where thousands and thousands of researchers bring you solution of problem thousands and millions of people have. So you need to take that and implement that to help the millions and millions of people to be more healthy and live a better life. If you don't use that, you start again like year back. And nobody can reinvent everything alone without knowledge. It's a nonsense, and nobody also can deny that it's how COVID is transmitted. Nobody can deny that we don't know how to stop that spread. So nobody can deny that it's not wise not to do it. And nobody can deny that push people not to do that is give them the risk to die. And when you do that with something else than a virus, you are just called a criminal. So what Rwanda did, Rwanda followed the science. And like many other African countries, the ministers of health of the continent were called by Africa CDC 2 months before the first case of COVID on the continent. And they discussed and recognized that it's not yet a pandemic, but it's serious. And in case it happened in one country, this is the protocol to follow. This is the action to be taken by this sector, this constituency. And they apply that. And that's, so people who doesn't recognize that is by applying the right thing that you have the right results, they're just wrong. And most of the case, they just try to cover up their own inefficiency. And so my advice is just follow the science. You have to innovate, of course. We don't have enough personnel, so we innovate and we brought robots to follow the temperature of people. We don't have good roads across the country, so we start innovating a couple of years before by using drone to deliver some drugs and medicine very far. So using innovation and using the knowledge of the science and contribute to that knowledge for the humanity and go as we learn is absolutely essential, and it's the only reason we have the result we have now. And this has been the case in Rwanda since I came back, because even for HIV, we saw what to do. And equity is the best tool for progress. People believe that the best tool for progress is to let people fighting with each other and some dominate others and grow like that. No, the best tool, and it has been proven, there is a lot of studies who show that equity is really, invest with equity, make your investment deliver more return. And this is how also in this country, you have made so much progress with peace. Meaning you have the medicine for 1,000 and you need to treat 100,000. And you just say that those are the criteria, we will apply it and fight corruption applying it so that everybody has the same chance. People accept that because they know that that time will come. They just pray that that time will come on time. But today we are at a point where nobody in Rwanda can say, I'm sick, I need IVs, and I cannot get it. And this is what we should be all proud of, because it's not the fact of the health sector only. It's also with the support of the local government who help to organize health sector in remote area, who help to build health centers in remote area. It is also the support of the financial sector, the education sector. Is a collective effort of the country to bring health and wellness to the citizen in equal manner, rural or urban, old or young, and by making the money work, and also the partners who have helped us to do that. So this is for Rwanda. So the way you organize a health sector to have the maximum return, the way you advocate to the leaders or to your colleagues or to the people you want to serve, for them to take what you propose, is also what we teach at the University of Global Health Equity. Because you need, if you create something great and nobody wants to take it, better go on holidays. And if you create something that everybody take but without quality, better go to holidays as well. But if you want really to serve with quality, you have to be on the table with everybody, even the people that you will serve. So they will tell you the best how to serve them. I didn't grow up in this country, so I didn't have those knowledge, but I apply them and it helped me to contribute at the best of my capacity.
Absolutely. Looking out a little bit now, obviously, you've had major impact with the infectious diseases. You mentioned some of the innovation in terms of the drone delivery to the rural areas, obviously everything you're doing at the university. As a clinician with specialty in your areas of neonatology and so forth, are there areas of biomedical innovation that you talk to people, read about in the literature that you personally are most excited about looking forward, whether they are have to do with infectious disease, neonatology, or beyond pediatrics?
So what I like and really where we should push young researchers to do in country like Rwanda is really to reflect how to make the discovery around the world more accessible to each and every Rwandan by making it more simple, what we call reverse innovation. And this will be a win-win situation for everybody, meaning if I am a very big factory in Europe and I do something that in any case will not, I cannot sell because too expensive, work with engineers in countries and find a version that is affordable, safe, with quality, and easy to manage by nurses, and because we don't have enough doctors everywhere. And we found things like that, like there is a fantastic vacuum machine that cost $80,000. There are some researchers here who have managed to create a model in plastic, 80% as efficient, not 100%, 80, safe for $7. So you see that I think this is the future, because up to the time we cannot pay the 100%, we can still pay the 80%, and we can pay it for all. So those are the reverse innovation that we should cultivate in partnership with the Western world, where it's a win-win situation for everybody. We don't compete, we are complementary.
Excellent message, wonderful message. Dr. Binagwaho, final sort of wrap-up question. We typically come back to our guests, and obviously you've met a wide range of very important people in government and industry and academia. Typically we give our guests the floor just to do any shout outs or mention any important mentors, leaders, influencers in the current time that are going to be instrumental, not just what you're doing at the University of Global Health Equity, but in other initiatives that you're going to be moving forward. Anyone you want to mention at this point in the show specifically, I'll give you the floor at the wrap.
So me, I will mention my president, because I like the way he governs, and I learn by people who manage to put the people before in front of their preoccupation. And I like his inclusiveness that has made Rwanda what we are now. I absolutely admire the fact that he managed to take a country but so divided, that many people, I had no trust about the people when I came back here. I was afraid to be killed with anything. And he managed to rebuild trust, to rebuild collaboration, to rebuild dignity of each and every one, the victim and the perpetrators, to give agency to the people. And this is a quality that is valuable in all fields, and that I'm still learning. The fact that you are able to discuss with people that you know that are very bad people, have done very bad things, but still see a light of hope in those people, and a light of humanity. And I'm not the best to do that. I'm still learning. So this is somebody I will point out, because is there. I also want to recognize the thousands of young people, very bright, who died for us to have the country we have now. So many times forgotten. There were so many who were brighter than us, who just decided enough is enough, we will not accept, we will go. And they die, they give their life for us to build the country. So it gives us a responsibility of success, of inclusiveness, and of equity.
Wonderful wrap-up message. I really appreciate that. Professor, it's been an enlightening time listening to you and your journey, and wishing you the best with everything moving forward. For everybody that's going to be watching this episode or listening on the podcast network, you've been listening to the amazing Professor Dr. Agnes Binagwaho, Vice Chancellor, University of Global Health Equity, doing really amazing things to change the way healthcare is delivered, innovation, quality, equitable healthcare for everybody. Professor, it was an honor seeing you and having you spend the time with us. And we say thank you for making a better tomorrow for everybody in this equitable fashion. It's been really inspiring.
Thank you for having me. Bye-bye.